Imagine living a life, having 100% health, no worries that your health is going to prevent you from doing anything that you want. Imagine living till you're 70, 80, 90, you pick your number, but along the way, because it's not about a number, along the way having quality of life so that it doesn't affect your values, what you love to do, and the things that you aspire to be able to do and have in your life. Do you think that that's possible? Because despite what science is telling us, we've been conditioned to think that it isn't. That we're just pre-programmed to decline as we get a little older and then to blame everything on old age. So I'm a firm believer that in order to be healthy, we need certain tools. And I want you to just expand your thinking a little bit and know that that is a possibility, but not just a possibility, that it is a true fact that we can have this quality of life and live healthy, long lives. Because we all know that we know of people that have lived long lives, but were a burden to a lot of the people around them because they didn't have the quality of life to support themselves. So today what I want to do is I wanted to give you tools to help you live that long life and introduce you to a wonderful concept, what I call a hidden gem in chiropractic care. So what I first want to do is tell you to participate, because we all know that through participation we get transformation. So I always like to give an analogy that if I was to give one person a sheet of exercise, told that person to just read about those exercises, and on the other hand give another person that same sheet of exercises and tell them to go to the gym and actually do the exercises, who's going to get the better results? Obviously the one that's going to do the exercises. So same thing here, that if you're expecting to get a transformation and get results, I want you to participate. So I want you to take notes as I'm talking, because as you write things down, you're going to retain a lot more information that's going to serve you for a lifetime. So one of the things I like to start with is actually our mission statement. And here at Roach Chiropractic Center, our mission is to touch the lives of as many families as possible through the highest quality chiropractic care that we can give you, so that you can achieve and maintain your health potential naturally without drugs and surgery. So this is very important, because as chiropractors, we don't prescribe drugs. It's not that we don't necessarily believe in drugs, we just don't think that it should be the first option all the time. So although there's a place and time for everything, many of you, and you might have done this yourself, we pick drugs first, surgery second, and if all hell breaks loose, we may find ourselves at a chiropractic office down the road. The other part of our mission statement is that we want to help guide, educate, and empower our patients to permanently shift their paradigm about health. So what is a paradigm? A paradigm is a model of reality that by which we view our life, we view certain concepts. So for example, the model of reality of our healthcare system is that if you feel well, you assume that you're what? That you're well. And if you don't feel well, you assume that you're what? That you're sick. Now, unfortunately, we all know people around us that had no symptoms and felt great, however, may have died of a heart attack, or unbeknownst to them, have undiagnosed cancer, and they go to their doctor feeling great, and all of a sudden they do a few little tests, and boom, there's stage 4 cancer, or stage 3 cancer, or high blood pressure, or high cholesterol, all of which can come with no symptoms whatsoever. And then lastly, we are dedicated to creating a culture that understands that maintenance of health is superior than the treatment of disease. So why wait till the crisis is there to create change in your life? Create change in your life now so that you can avoid that crisis down the road. So hopefully this resonates well with you, because this is who we are and this is what we do every day here at Roach Chiropractic Center. Now, I'm going to ask your permission to introduce a new paradigm, because this paradigm is going to shift the way that you think, and it's going to challenge a little bit what you've been told or convinced is true in the past by maybe your medical doctor or the people you hang around with, your family. But we're going to give you the science and create this new paradigm, this new construct that you can then use to create health in your life. So the first thing I want to talk about is universal intelligence. And I love talking about universal intelligence because I give an analogy. Imagine your favorite radio station. So just for an example, let's pick 96.5. So we'll get out of the digital world for now and still stay with the regular radio stations, 96.5. And what happens is if you're on 96.5, you're going to have clear, nothing is going to be interfering with that station, and you're going to be able to hear whatever you're trying to hear. However, if you turn that dial up or down and you go on 96.4, 96.6, you're going to start to get static. So we're going to call that interference. Now imagine your body is this huge radio station, and it's meant to be on a certain dial, 96.5. But because of what we do during our life and the choices that we make that might not be 100% congruent to having 100% health, that dial starts to turn and you start to hear that static. And that static is that interference that basically is interfering with your body's intelligence. Now, I want you to know that that intelligence that drives our body is the same intelligence that gives you your heart rate at 72 beats per minute, allows you to digest food, allows you to perspirate when you're hot, allows you to have a bowel movement, allows you to think, move your muscles. That intelligence, we don't want to interfere with it. And by virtue of the lives that we're living right now with stress and physical stress, emotional stress, chemical stress, we're creating interference to that intelligence, which then creates a body that's compensating, that's not at ease, that creates disease at one point. So just remember, your body is like a radio station that you want to keep dialed in, and the way you're going to do that is by the choices I'm going to educate you to make so that we can keep it dialed in, for this example, at 96.5. So at one point, when people come in to a chiropractic office, whether it's early or late, everybody's on a certain, on a spectrum of either having pretty good health or at the other end of the spectrum, having almost had a crisis or already had a crisis. Regardless of where you're at in that spectrum, there is a group of choices that you probably made that brought you to that particular spot on that spectrum. So when you take a look at the line that happens right before traditional medicine, that line represents a diagnosis. And that diagnosis comes to us sometimes at a surprise. So that could be cancer, it could be heart disease, heart attack, it could be an acute episode of low back pain. And what we typically do is then we go to the traditional healthcare route, and they're going to have their tools, which is most of the time a prescription of some sort, a referral to an orthopedic surgeon or a specialist of some kind. So that's not good, that's not bad, but let me put it into perspective. Imagine that you have a house, and one day you go into your driveway and your house is on fire, and you realize it's on fire. You're going to call the fire team. And the fire team's going to get to your house, and they're going to have the hoses and the axes and the ladders, and they're going to put the fire out. But at the end, you're going to be left with a mess. And what was left of your house is almost nothing. So that is really the traditional healthcare route. They're there to kill the crisis. So if you have cancer, boom, they offer chemotherapy. If you break your arm, they'll offer you a cast. And that is very helpful in that state of that crisis. However, that same house, now that you want to sell it perhaps, you're not going to call the fire team. It's the wrong team. You're going to call a real estate agent. You might call in a carpenter so that he can fix up the few little odd ends that need to be done before you sell your house. But you would never call the fire team because they would create havoc because there's no crisis. They would create a crisis by virtue of you calling them. So there's two different teams. And when people ask me, where does chiropractic fit in today's healthcare model? I say, well, you want to surround yourself with a healthcare team, a wellness team, people that are interested in keeping you well. But you also want to have a crisis team in case something happens, because I always give the analogy that if you have a broken arm, you're not going to show up at my office as a chiropractor for me to fix that. You're going to go to the crisis care team, your doctor or your emergency room, and they're going to put a cast on and it's going to heal. So two different model of realities there, your wellness care team and your sick care team, your crisis care team, which in this analogy was the fire truck. So we need both, and we can all agree that we're all good at certain things, and I would rather prevent than treat. So you need to surround yourself with a good wellness care team, including chiropractic. So another word for traditional medicine is allopathy. And allopathy, when you divide it up, allo means opposite and pathy means suffering. So if you have a headache and you take a Tylenol and the headache goes away, you basically avoided suffering. But does the Tylenol really know why the headache is there? Of course not. So if you're having a headache because of a stubborn spouse, That Tylenol is not going to get rid of your spouse. So just kidding, but fact of the matter is that sometimes we medicate ourselves out of a crisis, out of a symptom, and never really look at, why did I have that symptom in the first place? What is the cause of that symptom? Why did that come about? Without asking that question, you're asking for trouble down the road by always medicating your way out of a symptom that was there. And of course, if that symptom is based on habit because of something you're doing, I always tell patients, you can't medicate your way out of a problem that you behaved your way into, because it's a behavior problem. So you got to change your behavior in order to stop that symptom from appearing, not just take the medication to quell that symptom. Now, here's a typical medical approach. And this is very typical of people that come in and see me. They'll wake up with a muscle ache or pain, or over a period of certain years or months, they've developed a certain ache or a pain. Now, what happens is that they lose the ability to do the things that they love. And that's usually when people have a tipping point. And they'll say, okay, well, I want to be able to play hockey. I want to be able to run. I want to be able to pick up my grandkids. And what happens is that we want to get rid of that, and we want to get that back as quickly as possible. So the quickest route that we know, and then we've been conditioned to think, is to reach for that medicine cabinet, take a pill that numbs the pain. Now we're able to do what we love to do. So, crisis avoided, right? Well, not really. Because what happens then is that because the cause is not being corrected, it leads to sometimes poor sleep because the problem continues to happen. Emotional challenges, so sometimes we become a little cranky because the pain is affecting our lives, and we're starting to get self-esteem issues because we remember the person we used to be and we're not able to do that anymore. And then what we do, we find out that we're starting to lose even more activities that we love to do, and that could be you used to be able to run 10 kilometers and now you're only able to run 2. And people in that case will tell me, well, I don't let the pain, affect my life. I power through it. And when you really dig into their health history, you find out that the pain is running their life. And they've changed what they're doing because of that pain. And then typically at one point, everybody has a breaking point where they'll say, okay, what I'm doing is not working. I need to try something else. Maybe that is chiropractic. Sometimes people don't find out about chiropractic and they opt into maybe some unnecessary surgery or whatever. So we need to make sure that we've got our steps along the way that make sense. And I think chiropractic and alternatives that are far less invasive should be tried first before we go to the drugs and the surgeries. Now, I don't know if that resonated with you. If I described your story, it's probably the reason why you're watching this video and why you reached out to see a chiropractor, because if that's your story, we need to find out what the cause of the problem is. Now, one of the things that I talk about is Tylenol, because people come in and see me, one of the most common drugs that people are taking is Tylenol. Now, Tylenol, is also known as acetaminophen. Just taking one a day for a year increases your risk of kidney failure by 40%. And I know for a fact now Health Canada has changed the way that they label acetaminophen, because they know that it's more dangerous than they thought it was. And we give it to kids. When kids have fever, we give them children's Tylenol. And the whole goal of that is to lower the fever when the body needs to have that high temperature in order to kill the bacteria. Now, there are limits to what we can let a fever go to, but I always tell parents, make sure that you're tracking the fever often, so that way you don't, freak out when you see 104, only to find out that 10 minutes later it's back to 102 and it's fluctuating. As long as it's fluctuating, the best thing you can do for that child is to let the fever run its course, kill the bacteria, and instead of having a child that's sick for a week, it'll probably be gone between 24 and 48 hours. Now, that being said, the current paradigm that we live in, which is basically a medical pharmaceutical approach to symptom care, it is not working. We know for a fact, a study revealed that in the next 10 years in North America, over 7.8 million people will die from medical intervention. So really the fact of the matter is, in order to stay healthy, we need to stay out of the hospitals. And in order to do that, we have to change our paradigm, change our thinking, and wrap our heads around preventive. Wrap our head around being proactive about our health instead of reactive, waiting for the problem to occur, and then wondering, okay, what do I do now? And then having to call the fire team, the crisis care, your medical doctor, emergency room, and all these tests to try to avert the crisis, which sometimes they can't do, which ends up being death. And we don't want to do that. We want to be proactive, live a long, healthy life as much as we can. So in terms of breaking this paradigm down, we now know I'll ask you a question. Is it possible that a person could have heart disease, cancer, high blood pressure, high cholesterol, and yet not feel any symptoms at all? Of course. We know that that's true, and you probably have people in your life that you know had the exact same issue. Now, when a person has no symptoms, he or she is on the road to good health. No, not necessarily. This is very, it's contradicting what we've been conditioned to think, because we think that if we feel good, then we're going to assume that we're healthy. So one of the favorite questions I ask my patient is what is your most important asset? And the answer that I get is never, my car or my house. People answer this question correctly, and they tell me, well, by far it's my health. If I don't have my health, I don't have anything. And then my next question is, well, what is health? How do you define health? And then they go on to tell me that it's all about how they feel, and if health is feeling good. And that's when I say, well, unfortunately, that's not true. So what is health? To me, health is defined as your body's ability to express 100% of the intelligence that it has. So in other words, being dialed in correctly to that radio station we were talking about in our example, 96.5. And knowing that if you're dialed into that, your body is equipped to adapt correctly to its environment and anything that comes along with it. Now, as we start to stray from that station, from that 96.5, from that optimal set point that our body utilizes, we start to stray from that and we start to go towards the disease. Now, you can still feel good along the way. You can still feel great, feeling okay. Finally, you start to maybe feel a little bit of fatigue, which is, by the way, the #1 symptom in North America, which is why coffee companies, are probably thriving, because it's a #1 symptom in North America. So people sometimes need that coffee just to make it through the day. So if that's you, maybe there's other issues. Now, at one point, you're going to start noticing symptoms. And notice that symptoms is very closer to death than what it is to health. So symptoms are always late to the game. Point taken, if you have stage 4 cancer, that's usually only at that point where you start to feel pain. So if you're waiting for pain, in the cancer example, you're already at stage 3 or 4. So the last thing we want to do is wait for the pain, wait for the symptom. We want to catch things early so that we can hopefully prevent things from happening. Now, here's how the body works. Now, we have a brain and we have obviously the body, and the brain is meant to communicate with the body back and forth. So in the example of a heart, the heart beats 72 beats per minute. And what happens, the brain is telling the heart to beat, and once the heart beats, the heart sends a message back to the brain and says, I'm beating how you told me to beat, 72 beats per minute, and everything is good. If you have that happening without any interference, you're going to have 100% health, 100% ability to heal, 100% function, everything is working great. Now, in the event that we have that interference, in the event that your radio station is not dialed in to 96.5, to that optimal set point, we now have interference to that intelligence. And now the brain is not able to communicate properly to the body. In other words, we have a failure to communicate. And now the body is receiving abnormal messages. It is now relaying information to the brain based on the abnormal messages that it received from the brain, and now we have a dysfunctional pattern that starts feeding itself. And that's how we develop malfunction, dis-ease, and eventually we finally get symptoms where we've been conditioned to think, well, we'll go to the doctor, he's going to give us prescription drugs or whatever, maybe a surgery, get rid of the symptom, and now we're okay. But really we're not. By avoiding the cause of the problem, we're living shorter lives. Life expectancy here is 72, 74 years old, and we're copping out, according to science, our cells are made to live 120 years. So that's almost 40 to 50 years younger than what we're supposed to be living. And I think that's a sad thing when we have this beautiful machinery that's our body and the intelligence that drives it, and because of the choices that we're making that we're not informed to make, we're living shorter lives than what we're supposed to live. Now, what do we need to be alive? Well, we all know that we need water, we need food, we need air, but we can go without those things for a certain amount of time, right? You can hold your breath, you can go without food for a while, without water. But if you completely sever your spinal cord, you're dead within milliseconds. So a guy like Christopher Reeves, who fell off a what? He fell off a horse. He partially severed his spinal cord, so he didn't live a very healthy life after that. What happened was that, he started having, breathing problems, his lungs were compromised, his digestive system was compromised, and at the end, people were massaging his bowels, his stomach, just so that he can have a bowel movement. So that wasn't a problem with his digestive system. It wasn't a problem with his lungs. The problem was that his nervous system, his intelligence, his supply was dying. So the organs that were dependent on that brain to get these messages were not getting the messages properly, so they were dying. So in the event that you completely sever your spinal cord, you're dead within milliseconds. So your nervous system really trumps all other systems in your entire body as being the number one system because it controls all the other systems. So very important, your nervous system. I like to compare it to your electrical box in your home. If you bring that arm down, that stops the electricity from going to your house, nothing is going to work. That is your nervous system. Now, the healthiest people that I hang around with have introduced more of a four-dimensional model of healthcare, not a three-dimensional model like we've been conditioned to think. Now, the first part of that model that we all know is exercise. We all know that if you don't use it, you lose it, right? So exercise is really, really important. Now, eating also is very important. So your nutrition, eating organic foods and eating whole foods, again, very important. I always say that health is on the tip of your fork. Very, very important. Also thinking well. The people you hang around with, having positive thoughts. Sometimes I tell people, we hang around people we wouldn't even warm up to, even if you were cremated together. That's how negative the people that we hang around with are. So sometimes we need to take inventory of the people we hang around with, and sometimes that can be family members, it can be friends that we've had for a long time. So we need to be careful about that because you're the sum of the people you hang around with. Now the last part is really chiropractic care and having a healthy nervous system. So if your nervous system is going to dictate everything that your body is doing, you can assume that where there's a nerve, there's a muscle that's being supplied. So we're going to use this simple analogy, this simple example of a nerve supplying a muscle. So if you want to repeat after me at home, irritated nerve, tight muscle. So irritated nerve, tight muscle. If you have pressure on a nerve, like if you're stepping on a garden hose, you're going to alter the flow of that nerve, therefore affecting, in our example, the muscle. So imagine you've been conditioned your entire life to work at a desk, sitting down, doing repetitive work with bad posture. Maybe you're a carpenter, maybe you've been sitting in a car. Regardless of that repetitive stress, your spine has shifted over the years and put pressure on some of these nerves that are supplying the muscle. Now, in the case of an irritated nerve, you're going to get a tight muscle. Now, the muscle is tight, so let's start with that scenario. Your options for tight muscles could be a muscle relaxer. Now, you can imagine that you can take a muscle relaxer, but if you have a vertebrae that's out of alignment, putting pressure on a nerve, I've yet to have seen a muscle relaxer that takes that vertebrae off that nerve and allows that nerve to flow better. All it's going to do is take away the muscle tension temporarily, but therefore leaving the cause of the problem there, which is the actual misalignment, the structural problem that's creating that nerve pressure. Now, other options might be physiotherapy. The physiotherapist is going to look at that muscle, say, yep, it is tight, and give you stretches and give you exercises. Fact of the matter is, none of those exercises, none of those stretches is going to take the pressure off that nerve, which is the actual cause of that problem. Now, there's many cases where physiotherapy might be warranted, but in this case, it is not going to work. And some of you may have tried physiotherapy in the past where it didn't work. It's not that physiotherapy doesn't work, it was probably not the right thing for your problem at that time. Now, you can also assume that, based on the three-dimensional model, you could exercise your way out of this problem. You could eat your way out of this problem by eating healthier foods and taking, natural things that reduce inflammation and create better muscle tone. But the problem is not the muscle. The muscle is the effect of a cause, which is the nerve that's being irritated. And what causes nerve irritation is your lifestyle that created pressure from shifting those vertebrae, shifting the spine onto that nerve that is now problematic. So this is why we need to incorporate that fourth dimension. Instead of having a three-dimensional model of life or health, we need to add that fourth one, which is getting adjusted in chiropractic care. So let's elaborate on that. When people ask me what I do for a living, I'm not quick to tell them that I'm a chiropractor. Because one of the reasons I don't do that is as soon as I tell them I'm a chiropractor, they grab their neck and, they're doing this, right? And I always say, well, thank God I'm not a gynecologist, because it would make it very awkward when they're doing that. Just a joke, right? But fact of the matter is, I kind of wait to tell them I'm a chiropractor a little later. And what I do is I increase gaps. And I love the Socratic method. So what that means, I'm going to get the patient to ask, or the potential patient to ask me another question. They'll say, well, what is gap? And a gap is basically an acronym for your general adaptation potential. And all that means is that it's your body's ability to adapt to your environment. So if it's 23 degrees in this room and it's 26 degrees outside, if I leave this room and go outside and I'm not able to adapt to my environment, I'm called dead. If my body cannot adapt, you're going to have death. So the fact that we're able to move from one environment to the other, be exposed to pathogens like bacteria and viruses and still survive, means that our body is adapting. Now, how much we're able to adapt will result in how much health you can have. So I like to give the example of a threshold. So let's say we have a glass of water that's 8 ounces. And in that glass, we have 8 ounces of water. How much adaptability is there in that glass? Not a whole lot, because we know that the next drop of water, you're going to have spillover because the glass is already full. Now, if that glass is half empty, how much more can it adapt? A lot more. So let's say we compare that to our entire life. Let's say water is stress, and stress comes in 3 different forms: physical, chemical, and emotional stress. And over our lifetime, have you had physical stress? Well, the answer to that is yes. You've had repetitive stress, probably from what you do at work. You've had maybe acute stress, trauma, car accidents, falls, sports injuries. Unless you eat organic, grass-fed beef, free-range chicken, you've also had chemical stress from pesticides and antibiotics that are ingested in some of our food. And you've probably also had emotional stress, right? And we all do that. We all have had, in some way, shape, or form, one of these forms of stress. Let's say that that water represents the stress that we have. And let's say that glass is full. So we're already at threshold. And one day, the barometric pressure changes outside, and you get a migraine. And you'll blame it on the barometric pressure, although when you think about it, everybody that was outside or inside got exposed to that same barometric pressure and didn't get a migraine. So why did you get a migraine? Or maybe it's the first snowfall, and you go out and shovel and you throw your back out and you blame it on the shovel that was too short, and you blame it on how much you turn. Fact of the matter is, you didn't adapt. Or you're in a room where somebody's wearing perfume and you break out in hives and you break out with, you're sneezing and all that stuff. Everybody else was exposed to the same perfume in that room, but not everybody reacted the way that you reacted. So why is that? The fact of the matter is that you couldn't adapt further because you were already at threshold. Your glass already had 8 ounces of water. So the goal of anybody that's going to take care of you is to reduce how much water you have in your glass. So what does that mean? It means we need to address your backpack. We need to address your physical, chemical, and emotional stress so that you can better handle what? Life. And life comes with all kinds of obstacles that fill up that glass. But if your glass is already full, you're not going to react well to your environment and you're going to have problems. So the whole goal of chiropractic care is to increase your gap, increase your ability to adapt, so that way you can go into your environment, you can sit and you can be exposed to a change in barometric pressure. You can lift your grandkids, your kids, whatever, and not break that threshold and be able to handle that and be able to do it without any severe ramifications. Does that make sense? Cool. So how does sickness happen? Because we all know we hang around people that are sick, right? And they're basically justifying it, saying, well, it was a bacteria, it was a virus, or it's because I was in a room with somebody that was sick. And people make all kinds of, excuses to take away, to deflect the blame, really. Now, we have bacteria and viruses, but, we're all exposed to those on a regular basis. I'm exposed to them every day by virtue of taking care of people that are coughing in my face and breathing. I don't get sick. Some people will, so what's the difference? Also, people will blame it on bad luck, and they'll say, well, if it wasn't for bad luck, I wouldn't have any luck at all. People will blame it on genetics, although we know that 80% of the genes in our body are lifestyle driven, meaning if you live a proper lifestyle, those genes will never be expressed. So we make all kinds of excuses, Fact of the matter is, what allows your body to adapt to that is how healthy you are in the beginning. So we need to increase your health potential, increase your gap, increase your body's ability to adapt, and you can be exposed to bacteria and viruses and you will not be touched. Your body will be able to deal with that because it was meant to be able to do that. So what about subluxations though? So let me introduce the term subluxation. And very simply, a subluxation is a misalignment or dysfunction of the spine causing interference to the most important system in your entire body. What is that? That's right, your nervous system. And your nervous system is basically the innate intelligence that drives your entire body. So when you have interference to the intelligence that drives your body, you're not going to be able to properly recognize and adapt to your environment. So very simply, a subluxation is a misalignment of the spine that affects the most important system in your entire body, which is your nervous system, which then doesn't allow your body to adapt to its environment. So this is a very scientific process that I'm now going to start explaining and what causes it. So we've already mentioned the types of stress. We have physical stress. Physical stress is, either repetitive or traumatic. So your work, what you do every day, but also what you've incurred in your life, which could be car accidents, falls, sports injuries, whatever. Mental stress, we all have that. Chemical stress by virtue of stuff that we eat, that we're exposed to, like smoke, liquor, whatever it is, alcohol. And then now we have electromagnetic frequencies, which is basically stuff that's emitted from cell phones and towers and all the stuff that is not really congruent to having 100% health. So we need to monitor and manage these 4 stressors because we're not going to be able to avoid them, but we need to be able to manage them and create a body that's able to adapt to those stresses by virtue of making it healthy. Now, what do subluxations cause? Well, subluxations can cause anything because when you have a subluxation, you're affecting the system that runs everything, which is your nervous system. So if you're affecting your nervous system, everything is fair game. Now, I want to give you an example here about relationships. When I was in school, my first year in school, we're doing a clinical practicum, which means that we're taking people, from the streets. They're coming in to see us as students for us to take care of them. In my first case, I had this lady who's, very angry and cranky. She was in pain and had been in pain for a long time. And I started taking care of her with, the tools that I had at the time. And as a student, by far, you're not a professional yet, but, you're practicing. It's really, you're learning your trade. And after 2 weeks, she was getting better. And I was all, amazed and, happy for her. One day she shows up. This is about after a month's worth of care. And I open the door and her husband is there. And he had not been there before. So my first thought was, oh my gosh, what happened? I assumed the worst. He wasn't there to, be mad at me, or he was there to basically thank me. And when I asked him why he was there, he basically explained to me with a tear in his eye that they were about to get divorced prior to her seeing me as her chiropractor. She was in pain. She wasn't herself. They were in arguments all the time. She was cranky. And basically, they had drifted apart because of the intense pain that she was going through. So it made me realize that your pain affects everything you do and everybody around you. So never underestimate, the pain that somebody is going through and how it's affecting their life. So I always tell my staff, never judge anybody on their first week or so, because their personality is being driven by the pain and the suffering that they're going through. And we see these patients change, like night and day. As the pain starts to leave, they start cracking jokes and, they become, the bright lights in our practice that we love seeing. So just a cool little example on how your health affects everything. So what do? We do what's called an adjustment. An adjustment is basically, when we take a look at the new patient exam, the patient exam that you had, we assessed your range of motion. So very simply, your neck has 6 degrees of range of motion. So there's extension, there's flexion, there's rotation, and there's side bending called lateral flexion. So when there's a lack of range of motion, it's typically because you have 1, 2, 3, or whatever, how many segments, vertebrae that aren't moving well, and the others can't compensate enough. So it's showing up as a reduction in how much you can move around. So what we then need to know is exactly which vertebrae that is happening to. So in the example of the neck, there are 7 vertebrae in your neck. So let's say it's your C5. Well, we need to locate C5 to make sure that that's the one that's causing that change in your range of motion. Now, maybe it's not causing a change in your range of motion because the others, the problem is young enough that the other vertebrae, the other 6 vertebrae, are moving more to compensate. So that's why, if somebody tests your range of motion, like your medical doctor, and says, you're fine, there could be hidden problems in there that he doesn't know about because he's not trained to really assess the spine from a motion standpoint. So let's say C5 is out of alignment. We got to figure out in which direction that particular vertebrae is not moving into. And what we do afterwards is the adjustment. And that's really what we do as chiropractors. So physiotherapists do not do adjustments. Physiotherapists do manipulations, which are done very, very differently. And I won't go into the details, but we as chiropractors train 8 years to be able to do very specific adjustments. And the reason I say specific is because, one, we have to locate the vertebrae that's out of alignment, and then we got to decide what part of our finger that we're going to use to gently move that vertebrae in the direction that it's not moving into, because we all know that if we don't use it, we what? We lose it. So a vertebrae not moving into a direction is only going to invite degeneration, a disease called arthritis, right? We all know that arthritis happens because of old age, right? Wrong. Arthritis happens because nobody ever assessed your spine and detected those little areas that weren't moving well. So by virtue of that area not moving well, the body degenerated in that area. And now you get to call it arthritis, and you finally get to see it on an x-ray. And if you're in your 50s or 60s, your doctor's going to blame that on how old you are. And that is the furthest thing from the truth. So what we do afterwards with the adjustment is we're going to gently push that vertebrae back into the direction where it's not really moving into at the time. And by virtue of moving that vertebrae, we're basically re-ingraining that pathway that was lost over the years of your brain now noticing that there's better movement there. And when the brain notices that there's better movement there, the brain tells the muscles that they can kind of relax in that area, that they don't need to protect anymore. And when that loss of protection, when that muscle starts to loosen up, that vertebrae starts to stay in better alignment. And now we're ahead of the game, and now that joint's moving better, and now we have better function. So the funny thing is, I had a patient who was trying to refer her sister. And she was saying, my sister is so stubborn. I'm telling her the miracle that I had in your practice, and she still doesn't want to come in. So I decided to role play with that patient. I said, I'm going to pretend I'm your sister, and you're you, and you're going to tell me why I should see your chiropractor. So this was hilarious. So the lady started, says, well, I come here, your staff is wonderful. They greet me by name. I come in and see you. You check my spine. You crack my neck. And I'm like, whoa, that is probably why she's not coming in. Who in their right mind would want to come to see somebody that they don't even know to crack their neck? So by virtue of how she was explaining her experience, her sister didn't want anything to do with that experience. So that whole cracking noise that people hear when we do an adjustment is simply gas. Yes, it's gas. So when we crack our knuckles, what's happening is that there's gas release, which is nitrous gas, that makes that noise. Now, inadvertently, because we're going to be closer to the ears, a neck adjustment sounds a little louder than a lower back adjustment. And all it is noise. It's not the joints that are, rubbing together or breaking or any stories you may have heard. It is simply gas release, which creates a noise, a gas bubble, that you now hear a little bit more in the neck versus the lower back. Now, a healthy nervous system basically coordinates the function of every single cell in your entire body. So your nervous system is top priority, and this is why we're so excited as chiropractors. We get to work with that system and change lives. Now, your nervous system is so important that it also controls your immune system. So here's a cool little study that said that over the 6-month period of the study, the control group experienced a 7.96% decrease in CD4 counts, while the adjusted group experienced a 48% increase in CD4 cell counts over the same period. So here was the structure of the study. There was 2 groups, both with HIV, okay? So a group of HIV patients, one getting adjusted, one not getting adjusted, one receiving chiropractic care, the other one not receiving chiropractic care. And they were tracking the CD4 cells, which are basically immune markers. And the group that was getting adjusted, their cells, their CD4 cells went up 48%. And the one that was not getting adjusted was going down 7.96%. So does chiropractic help your immune system? Yes. Why? Because it's not a pill for your immune system. Chiropractic heightens the level that your nervous system can perform, which then controls your immune system. So by virtue of having a healthy nervous system, your immune system is happier. We see this in our practice all the time with patients that tell us that since they've started chiropractic care, they're not getting sick during the winter anymore. They're healthier. People around them are getting sick, but somehow they're avoiding getting sick. And that hidden secret, that hidden gem, is the fact that they've started chiropractic care and their nervous system is healthier. Now, the summary of that study basically said that chiropractic patients had a 200% greater immune competence than those who had not received chiropractic, but a 400% greater immune competence than those with cancer or other serious diseases. Pretty cool study. Now, here's one of the biggest studies that was done on senior citizens. And as you can tell, the highlighted yellow things that are there basically are what seniors got from being under chiropractic care. So obviously, better overall health, fewer symptomatic chronic conditions, less sick days, in hospitals. That's important because that's quality of life. This is what matters. 87% of chiropractic patients describe their health status as good to excellent. These are seniors. The chiropractic patients were also less likely to use prescription drugs and more likely to exercise regularly. I read an article that the average senior citizen in Canada is taking about 13 prescription drugs per day. And I always joke around, at that point you need that plastic container that says Monday, Tuesday, Wednesday, Thursday, because you're literally taking a meal of prescription drugs every single day. So that is not the life that we want to really live. Now, about kids. Kids are dear to my heart, and we see a lot of kids in our practice. And the reason being is because when a kid exits the birth canal, there's a lot of force applied to the head, to the neck area, to get that newborn out of the birth canal. So a typical natural birth will exert about 85 to 95 pounds of pressure to the neck. Now you have to realize that the neck, the vertebrae aren't formed yet. Basically, they're just cartilage at that point. So that force is drastic and traumatic to that child. So 85 to 95 in a natural birth. In a C-section, vacuum extraction, or a forceps delivery, the forces are anywhere from 95 to 100 pounds of pressure to the neck. Now, the spinal cord has been studied to completely decapitate at 110 pounds of pressure. So realize that from birth, a newborn has already experienced a lot of trauma by virtue of the cord stretching by that pressure from the medical doctor or the tools used to get the child or the newborn out of the birth canal. So I had an experience with a patient of mine in my second year in practice. She came in during her third trimester for pain, during pregnancy. She couldn't sleep, sciatic pain going down her leg. And she basically, Googled us online and saw that we could provide help. So she came in and I said, well, we didn't really catch it early. You were in your third trimester. She had about a month and a half left before the birth. But she said, I'll do my best. So she started really getting better. And deep down inside of me, I wanted to tell her that when her child was born, we should check it for subluxations because of the reasons that I just told you, because of the trauma that happens from the birth process. But for whatever reason, I thought, she would object and we'd kind of go into a little bit of a confrontation. So I kind of let it go. And what happened is that she had her child, young boy, after 2 months, that child died of crib death, what we call SIDS, sudden infant death syndrome. And deep down inside me, I had that somber moment that I had failed her in a way that I hadn't shared that story, the importance of having a child check from chiropractic care from birth. And the reason being is because of a study that was done both in 1979 and 2007, where they did autopsies on 8 kids that had died from SIDS. And both times, 8 kids in 1979, 8 kids in 2007, both times, 7 out of the 8 kids were found to have hemorrhage in the area of the brainstem and a misalignment in that area causing that hemorrhage, that interference to the most important part of the nervous system. So we all know the nervous system is very important, but the most vital part of the nervous system is the brainstem where your cardiorespiratory center is. So basically, what did the kids die of? Pressure on their nervous system. So this is why it's so important, as soon as a child is born, to have their spines checked. It's the first thing that my children had was a spinal checkup as soon as they exited that birth canal, before any measurements were taken from the nurses or whatever, because I was I had so much conviction at that time of birth that I wanted to make sure that my children had the best chance possible at having a healthy nervous system from birth. So very important to have kids check for those reasons. Now, kids that have subluxations, what kind of symptoms are they going to have? Well, what about colic? What about constant ear infection? I have kids coming into my practice. The parents are saying that antibiotics is a custom practice in their household because the kids are always in and out of ear infections. That's not normal because that'll lead to tubes in their ears, and that's what gets promoted. And we all know that that is just basically the effect and not the cause. Moms stopping to breastfeed because the child might latch on one side and not on the other, because as soon as he turns his head to the other side, he's crying because he's got neck pain. So again, very important that we're trained to look for those things, that you give us the opportunity to check your kids so that we can free them from the devastation effects of a subluxation. So here's basically the summary of that study, which is done at Harvard. Research indicates that the major cause of spinal subluxation in infants is actually childbirth. So again, we can't stress it enough. Bring your kids in, have them check, and that way you can make an educated decision on whether or not you want to pursue chiropractic care. Now, some of you who started chiropractic care in our office on day one, we recommended that you had an X-ray taken. And the reason being is because your spine is made out of natural curves. So when you view your spine from the side, you have one in the neck, middle back, lower back, and your sacrum area at the very bottom part of your spine. And what we want to see is a beautiful curve, specifically in the neck, that measures 42 degrees. So let's write that down, 42 degrees. At 42 degrees, there's no pressure on the brainstem. The brainstem is healthy, your nervous system has no interference to it, and the messages from the brain are being able to be delivered wherever they need to go, and vice versa, messages are coming back to the brain to make sure that everything is okay. Now, by virtue of sitting at a desk all day long, for months at a time, years at a time, not eating healthy, having emotional stress, muscles get tight, your spine changes, you end up with a phase 1. And with a phase 1, what we see is a lack of curve. So you can see here that the neck is perfectly straight and doesn't have the curve that it needs at 42 degrees. Going back to that picture of phase 1, this usually happens 10 to 15 years. So it takes 10 to 15 years for that spine to degenerate so that the curve is gone. I had a 9-year-old patient I started in my practice. The mom came in first, and I said, look, I really want to check your child, because when I came in during the exam, the child was there texting and had really bad posture. And I had a good feeling that I was going to see something on the X-ray. So I basically told the mom, I also want to take an X-ray. And she was really, coming up with all kinds of objections. She didn't want to do this, she didn't want to do that. And I said, look, it's not going to cost you anything today because we were doing a promotion at the time. I want to check your child. We're going to send him for an X-ray. The X-ray comes back at 9 years old. He's a phase 1. And she can't understand. And now she's all ears and all eyes. And I said, well, you tell me why you think your son has a phase 1 degeneration at 9 years old. Now, it all came to her very quickly that when he was 3 years old, they had been in a car accident. And that car accident, they had the paramedics come on board and check the child. Blood pressure was fine, and they sent her home. So that was probably not the right thing to do. We should have had that spine checked very early, and maybe it wouldn't have been a phase 1 at the time where I checked him. Now here's a phase 2. A phase 2, you start to have decreased disc space. And when you have decreased disc space, you start to have more pressure on the nerves. You start to have bone spurs or spinal spurs. And then finally we have a phase 3 where you actually start to have fusions. And this takes about 35 years to develop. Now the good thing is that in our office, we do what's called structural care. And structural care allows us to take you from a phase 2 back to a beautiful, normal, 42-degree curve, phase 0. Now, you will still have, let's say you came in with phase 2, you will still have those bone spurs. They're still going to be there, but because we increase the curve in your neck, you now have more spacing between the vertebrae, which means that now the degeneration that you have is maybe no longer putting pressure on the nerve, which means what? You still have arthritis, but your pain is totally left. And now we can manage that curve so it stays there, so you're not stuck taking, Celebrex and anti-inflammatories and muscle relaxers and all the things that you probably were taking before you saw us. So how long does this take? Well, we know for a fact that different tissues take a certain amount of time. So if you cut yourself, your skin's going to heal very quickly. In terms of your nervous system, it takes about a year. So we say here 14 months. For the most part, let's call it 12 months. Now, how are we going to base how often you need to come in? Well, it's not going to be based on how you feel. It's going to be based on very objective measurements. The number one thing that we do that I love is your scan. And we always say, a picture is worth 1,000 words. That scan allows me and allows you to see the amount of stress that your nervous system is under. A very cool tool that allows me to be able to better recommend things for you. Now, we're also going to check your range of motion, your posture, your weight distribution, all things that we can measure again down the road. So your care is going to be based on the amount of dysfunction, based on the objective things that we're measuring, not how much pain you're in or how little pain that you're in when you walked in. Now, when we're going to be done tonight, you're going to come back for your appointment. We're going to discuss your plan. And that plan, is going to be, here's what we found, here's how long it's going to take, your investment in terms of, what's going to be your costs. And you're going to be given 3 options. I'm not going to recommend all 3. One of them is to do nothing. You could say, well, thank you very much for the information. I don't want to do anything. The other one is to basically say, okay, well, I get it, and I'm all in. I'm going to do a year's worth of care, but deep down you're lying, because as soon as you feel better, specifically guys, as soon as they can, swing the club again and go to the golf course again, because they feel good, they stop coming in. Everybody has a breaking point, and at one point they say, okay, I'm done dealing with this pain. I'm ready to listen. I'm ready to do that year's worth of care that you talked about, way back when I first started. The other option is to do what I did and to do structural care. Do it correctly. Do the year's worth of care. Change the structure of your spine. Change the function so that way you can have long-term health. Now, the way I got started with chiropractic care is I was playing soccer, and I was playing university soccer, and the first time I went into the corner with a guy who was a little bit bigger than me. He basically, pummeled me to the ground, and I had this horrendous pain going down my leg. And my toes were curling. Things were so horrible. And, the paramedics came on the field, and they said, you got to go see the doctor. So the next morning, I went to see the doctor. He was with me 2 minutes, gave me prescription meds, which I then, filled the prescription, because that's what I was trained to do at the time, to listen to the medical doctor. And to no avail, week 1, week 2, I'm still in a lot of pain, and I'm a 4.2 GPA, and I nearly failed 3 exams taking these darn drugs. So I then saw, massage therapists and a physiotherapist, and to no avail. So one day I'm going up the science department, and this guy meets me halfway and sees that I'm in horrendous pain. I haven't slept in 2 weeks, and basically asked me what was wrong. So I told him the story, and he says, you know what, it's funny. He says, I've been teaching for 10 years, and I'm back in school to take my science classes to become a chiropractor, to apply to chiropractic school. He says, my brother is a chiropractor here in town. He's going to be able to help you. I'm going to make you an appointment. So before I could say no, he had me on the phone with him, and I had an appointment that afternoon. Let me tell you, that appointment changed my life. So I went there. He spent an hour with me, which is 58 minutes longer than the first guy, the medical doctor, assessed me from head to toe, and told me to come back for this class, which I'm now telling you over video. And it changed my life. It told me where health came from. It told me where sickness came from. And then the next day I had an appointment with him so that he can give me my first adjustment. I went home that night after my first adjustment and slept the entire night. It was the first night I slept through in 2 weeks. So I went back the next day and I said, Francois, you got to do it again. Don't change your recipe. Do it again, because I'm feeling better. So lo and behold, after the 5th, 6th adjustment, the pain in my leg was gone. I was playing soccer again. And after my first game back, I decided to become a chiropractor. So I went to the registrar's office, changed my course load, and decided right then and there that I was going to become a chiropractor. Now, the part that I didn't tell you is that when I was laying down on the ground in pain, I had a flashback back in 1987. My dad said yes to a surgery where he was being flown to Toronto for what I call exploratory surgery. And I remember, back then being 6 years old. And my dad, I was waking up in the morning, my dad was next to the stove so he can warm up his back before he went to work. He was a construction worker in so much pain. And I remember my dad at one point, just being in so much pain that he said yes to the surgery. This doctor in Toronto was doing this new surgery. And basically it involved a striker bed where they put a crown on your head and they were going to straighten him out. Well, lo and behold, he went to Toronto. 1 surgery led to 5. And he was paralyzed from the waist down after the 2nd surgery. And they told him that he would never walk and, run again. He would have to, maybe not have bowel control. So all these nasty things that came about these surgeries. Now, when I was laying down on the ground, I thought, oh my gosh, this might be a genetic thing. I might be becoming my dad. And I had, the fear of God. So when chiropractic gave me my life back, and thinking back, it was such a hard thing. I remember my dad, we didn't know if he was going to make it home for Christmas. So this was October 31st, where he went out to have his surgery. And finally, we got a call that he was going to make it back before Christmas. I remember seeing my dad for the first time weighing 92 pounds. He basically had nothing and had to start that whole process, basically a child, that needed all this care. So, when I got my life back with chiropractic, I said, you know what? I never ever want to have to leave my family behind to have a crisis intervention because I failed to take care of my health. So I committed 100% to chiropractic care, and once I got my health back, I committed 100% to health. So, health is everything, and health is, if you don't have health, you can't enjoy life. So, like I said, how long is this going to take? It's going to take a year. So it's very comparable to, putting braces on your teeth. After the braces are gone, you need to put a retainer on. For how long? The rest of your life. So now we'll coach you at that point. At the end of your year's care, we're going to coach you on how to maintain the alignment on your spine. And that's basically periodic visits to the chiropractor to maintain that alignment. A wonderful guy, Thomas Edison, said, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and the cause and prevention of disease. He must be rolling in his grave, because this is not what healthcare has become." So what we want to do is, at one point, we want to touch base with you, go over your appointment calendar, how much care you're going to need. Missed appointments, we're really key on this, so that missed appointments get rescheduled within 24 or 48 hours, because those appointments are there for you. They're going to amount to the result you're going to get at the end of the year. So make sure you make up those appointments. We do go away periodically for conferences and continuing education classes. This is for us to be, the best that we can and offer you the best quality chiropractic care. Watch for upcoming workshops. We do those every last Monday of the month on various different topics, because our goal is to educate you and empower you with tools that you can then use on Monday morning right after the workshop to basically make yourself healthier and go into that direction. Remember that for your family's spinal checkup is included 14 days after your initial patient exam. So 14 days after your new patient exam, your family can come in and no cost to have the exact same exam that you had done that revealed so many things. Remember, the nicest compliment you can do to us is refer your friends and families. You might be watching this video thinking, oh my gosh, my brother should have heard this, my sister should have heard this. Give them the gift of health, because them coming in here and having their lives change, they'll forever thank you for caring enough to give them that gift of health. So thank you so much for listening. I look forward to seeing you in the near future. Take care.